What's up everybody, it's Dr. Scott with the 2-Minute Fix. What I want to do today is cover the third part of keeping your chest vertical in the bottom of a squat. So far I have covered thoracic extension. Make sure you check that one out. I've covered a lengthened heel cord or ankle mobility. You check that one out. What we're going to cover today is hip mobility, and this is kind of the last one in this series, so let's get at it. Okay, what I'm going to show you is 3 exercises for hip mobility. The first one we're going to start with is kind of a capsule and external rotator mobility. So what you're going to do is, let's start with the right leg, bring that one into 90 degrees hip extension. So you have to really take that opposite leg back, bring the front leg forward, and what you're going to do is lean in inside of the knee. So what we're working on here is really mobilizing the outside of this hip. So I'll show you a little bit this way. And the goal is to be able to get your elbow down to your ankle. I'm not there yet. And it's also early in the morning. But basically, just kind of work in that position. And you can hold these ones for maybe 10 seconds at a time. Again, I don't really love the long holds, but sort of get in there, mobilize that hip capsule. The next one's for Piriformis Mobility, and what you're going to do is cross the leg, and really just trying to gently push that hip and femur into external rotation. Sometimes we call this one the figure 4 or the exec stretch, because you can do this in a chair as well. You can actually do this seated or on the floor as I just showed you. And really all it is just getting that ankle on the opposite knee and gently forcing it into a little bit of overpressure into external rotation. Again, if you think about a squat being a combination of hip flexion with a little bit of external rotation of the femur, we need to be able to get into that deep sitting position. This is a really good one for people, especially if you've sat a lot of your professional life. What happens is we need to really mobilize this hip. So we're going to show you that one, and then the other one is going the opposite way. So drawing the knee across and really stretching that lateral capsule of the hip. You can also mobilize these with a lacrosse ball. You would just put yourself in that position, throw the lacrosse ball in there, and kind of mobilize a little. Okay, step through the band. The last one's going to be a banded hip extension. You get that band up high in the upper part of the thigh. Step forward with the opposite leg, and then drop into single knee support. The idea here is we're drawing some distraction of the hip capsule, anterior to posterior, front to back. And you can play with this one just by bringing that hip forward, holding for about 5 or 10 seconds. You can also change the position of your foot, either drawing it behind you, depending on kind of where you feel you need some help. Or you can internally rotate the femur, heading the opposite way, and then again, just leaning, bringing that hip forward, vertical chest, 5 to 10 second holds. It's been Dr. Scott with the 2-Minute Fix. #is your doctor you can lift. See you next time.